Good afternoon and hello. My name is Renee D. Waring, and I am the founder of Uniquely and Wonderfully Made Ministries. The title of my talk today is Homeless People Mental Illness Part 2 R Waring, WARRING. The material for this presentation comes from Homeless Hub, a weekly newspaper. You can find my presentations on the following social media sites: on LinkedIn under Renee D. Waring, on Facebook under Waring Communications, LLC, on Twitter under @Renee Waring, and on YouTube under WARRING. The causes of homelessness are an intricate interplay between structural factors, system failures, and individual circumstances. Structural factors are lack of adequate income, access to affordable housing and health supports, and or experience of discrimination and shifts in the economy. Structural factors are also include poverty. Impoverished people are frequently unable to pay for the necessities such as housing, food, childcare, healthcare, and education. People who have housing pay more than 30% of their income for housing. The system failures are difficulty in transitioning from child welfare, inadequate discharge planning for people who leave hospitals, prisons, mental health and addiction facilities, and the lack of support for immigrants and refugees. The personal circumstances and relational factors are traumatic events, fire, job loss, domestic violence, family breakup, and mental and drug addiction challenges. It has been established that poverty is the major cause of homelessness. Delusional thinking, withdrawal from friends, family, and other people. The loss of support affords them fewer resources in times of trouble. Mental illness can also impair a person's ability to be resilient and resourceful, and can cloud their thinking and impair judgment. Previously mentioned factors are why people with mental illness are at a greater risk of experiencing homelessness. The state of being homeless amplifies mental illnesses, which are mental health conditions. The needs of homeless people are the same as those in the general population. These needs are physical safety, education, transportation, affordable housing, and affordable medical dental treatment. When homeless people receive care, it is important for them to be treated in a non-threatening and supportive atmosphere. The need for food and shelter must be addressed first. Homeless people with mental illness are on the streets for longer periods of time and have less contact with family, friends than homeless people who do not have mental illness. 27% of women who are homeless with mental illness, 70% of homeless women with mental illness have mental illness. 20 to 25% of homeless people have co-occurring disorders, which is mental illness and drug addiction. If homeless people who have mental illness were able to access supportive housing as well as other necessary community programs, it would drastically reduce the homeless population. Thank you for listening to my presentation today on homeless people who have mental illness. My next presentation will air on the second Thursday or Friday of August. Repeat, the second Thursday or Friday of August. Please review my videos and ask someone to view them also. My presentations can be found on LinkedIn under Renee D. Waring, on Facebook under Waring Communications, LLC, on Twitter under @Renee Waring, and on YouTube under WARRING. My book entitled The Warrior Waring Second Edition is on Amazon.com. Gain a greater understanding about the challenges of mental illness. In it, you will find resources for people who have mental illness to be able to get treatment. You will also find resources for caregivers and family members. From my book, you can learn how to prevent suicide. I am the founder of Uniquely and Wonderfully Made Ministries. My name is Renee D. Waring, and I am the Warrior Warring.